are going to introduce two stomach cancer patients that are on our panel here. Jason Diaz, who I just met moments ago, and I've heard his story through my wife, Aki. And by the way, Hope for Stomach Cancer is a 100% volunteer-run organization. So my wife and I have a 13-month-old son that's being watched by, well, one set of grandparents is right here. The other set of grandparents is watching our 13-month-old son. But so we've been quite busy in putting this whole thing together. But I've been hearing Jason's story through my wife, and I know it was just recently that you had your stomach removed. And then also we have Branny, who's also a stomach cancer survivor as well as a veteran. Thank you for your service, Branny. So I guess, Branny, do you want to start? Okay, Jason, you start. Okay. Oh, you have a mic. Okay, great. So Jason Diaz, stomach cancer survivor, and recently had a stomach removed.
Yeah, perfect. All right, let's see. Perfect. All right, guys, can you guys hear me okay? Yeah, perfect, okay. First and foremost, thank you all for being here. I'm just gonna share real quick my journey with everybody on how I was diagnosed with stomach cancer, what care treatment I chose, and how I'm recovering from my stomach removal 19 days ago. So this is me in 2016. This is when I first started having my symptoms. Very mild heartburn, and that's typically one of the first symptoms that you're ever gonna get. I was using Tums and all kinds of other over-the-counter acid medicines, and they were subsiding the pain for about a year. Summer 2017, I start to notice that the pain is getting more and more frequent, and I'm not able to deal with it anymore just with Tums and some of the over-the-counter medicine. But I'm still trying to push through because I'm working 45 to 50 hours a week, and I'm always on my feet, so at times my mind was tricking my body into thinking that everything was okay. September 2017, the pain becomes so unbearable that I'm having my wife burp me in the middle of the night because I feel like I have so much gas trapped inside my sternum. So I said, enough is enough. I'm not able to sleep. I'm literally waking up every day at 3 a.m. and I'm staying awake until I get ready to go to work because there's just no way that I was able to lay on my back. September 2017, I start to really feel the pain at work to the point that it's starting to cripple me. So I decided to go ahead and go to urgent care because at one point I couldn't even walk or drive. And luckily my wife was across the street at her mother's house from where I worked, and she was able to pick me up and take me to urgent care. When I go to urgent care, the first thing the doctor tells me when I tell him my symptoms is he says a classic case of GERD. So after he told me a classic case of GERD, he gave me some over-the-counter medicine, some prescribed medicine, and he said, take one of these pills a day, I guarantee you it's gonna make you feel better. I said, perfect. Now what he didn't tell me at the time was the pills are only supposed to last 30 to 60 days before you should have a difference in how you feel. I was taking them for almost 6 months. And I had no idea that I wasn't supposed to be taking them that long because even when I was taking the pills, I still felt some heartburn going on. It never fully went away. So in 2018 of May, I called my doctor because he declined a prescription refill. And I didn't understand why he declined the refill, but when he called me, the first thing he told me was, why are you taking this medicine for so long? And I said, well, the urgent care doctor prescribed them for me. He never told me how long I could take them for. He told me, stop taking them, they're not good for your health. They're making you deficient in vitamins and nutrients that you need. So he said, come to my office and take a physical with me, and let's get to the bottom line of why you're having this much heartburn. So in 2018 of May, towards the end, I go to him and I'm explaining to him my symptoms. But at this point, I already did Dr. Google and I'm looking online to see, why am I having so much heartburn? Why is my stomach hurting so much? So I already have it in my heart that something else is going on because I know my body. And when I first started getting heartburn, everybody told me that welcome to the 30s club. You're 30 years old, welcome to getting heartburn. But I knew that heartburn shouldn't feel this bad. It shouldn't hurt this much. So I explained to him at my physical that I don't think it's GERD, I think it's cancer. And he told me, he looked at me, and I respect my doctor. I have nothing but good things to say about him, but he looked at me and said, "You're crazy. There's no way you have cancer. You're only 32 years old. You're pretty healthy from what I could tell, slightly overweight, but there's no way that you have cancer." And I wanted to believe him, but something in my heart told me don't. Like, go with what your body's telling you. And he was writing me a prescription to do a bacteria test, and he told me, "Come see me in 1 month, and we'll figure out what's going on with you." He had the prescription, he had the referral already set. He literally handing it to me. And once again, my heart and my brain were telling me, don't settle for this. There's something else that's going on. So I lied to him. And you're not supposed to lie to your doctor. And I'll be the first to say that. But when you have to advocate for yourself, you have to do whatever means are necessary. And I told him that I was bleeding when I was going to the restroom. And it had been going on quite frequently. So being the good doctor that he is, he freaked out right away and said, "Well, you didn't tell me this. Now I'm going to send you to get a GI, meet a GI so he could do an endoscopy for you because it could be something really serious." So I said, "Perfect." Even to get a appointment with my GI specialist, it was still 2 months out. I don't know if the demand for them is just not there, but it was almost two months for me to get an appointment, but I wasn't going to let 2 months go by. So I called every single day. To see if anybody had a cancellation. Any of my local GIs had anything that opened up. And luckily on June 12th, I met Dr. Weiss from Downey, PIH, and he asked me what's wrong. I told him exactly what my symptoms were, and he told me the same exact thing. "I highly doubt you have cancer. I highly doubt you have anything going on, and there may be an ulcer, but it's nothing to really be worried about." June 20th comes because he decides to do an endoscopy on me. I go in at 7 in the morning to get the endoscopy done. And he tells me, "Don't worry, this is going to be done in a couple minutes. I don't expect to find anything. You're going to be back to feeling normal pretty soon." I wake up, and he's sitting right next to me in the waiting room. I knew right away something was going on. But being the doctor, the good doctor that he was very optimistic and told me that we weren't going to be able to tell you exactly what the findings were until we sent it out for testing. But make an appointment and come see me in 2 weeks. Well, the 2 weeks never came. Now, this picture right here was taken on June 24th, okay? Looking really healthy. On June 26th, I found out I had cancer. So you would never guess at this point in my life that I had cancer. I was living with it. But it turned out that I was diagnosed with cancer on June 26th, and the tumor was a T3, N0M0, what they could tell, which meant that the tumor was starting to grow. So the first thing I did was I freaked out. Who doesn't freak out when you get told you have cancer? I called the most important people in my life right away, and I explained to them what was going on. And right away, we went to combat mode. What do we need to do to try to beat this? Where do we go? What questions do we ask? So I was able to get 3 opinions, and 3 opinions within 2 weeks. So the first one was through PIH Downey, and they're the originators that found my cancer. And through them, I was able to have the endoscopy, a CT scan, and a colonoscopy all done within a week. And the reason why I want to say I got this done within a week is because I was knocking on doors and making phone calls, calling my insurance, letting them know that I was going to be having multiple opinions, don't decline anything, letting them know that, you're going to be hearing from multiple doctors, but I knew that something had to be done. I went to PIH Whittier the next week, and they were able to perform a EOS endoscopy, which is an ultrasound endoscopy, which is a little bit more accurate of an endoscopy as far as how the tumor is staged. And then lastly, and thank God, when I first called City of Hope, they were my first choice before I ever went to PIH Downey and PIH Whittier. But City of Hope had a two-week waiting period for them to have an appointment with me. So come this second week, I already had the EOS endoscopy, the colonoscopy, my CT scans, and an endoscopy. So they were able just to do another CT scan, my port procedure, and the laparoscopy to make sure that the cancer hadn't spread. So all that was done within 2 weeks. Very, very fortunate that the ball got rolling quick on that. But to all my warriors out there and all the caregivers, you have to advocate for yourself. You have to make the phone calls, because if you're not out there pushing for you, you're not going to really find anybody on the insurance side pushing for you. You have to be your biggest advocate. So all the tests and procedures were within 2 weeks. City of Hope, the reason why I chose them was because not only did they give me the most hope, they had the greater technology. They had the doctors were more experienced in the gastric part of cancer, whereas a lot of the local doctors, they were general surgeons. And nothing against them. I'm sure they are great at what they do, but when it comes to gastric cancer, I highly recommend that you get a gastric specialist. Someone that has multiple, if not hundreds of operations to their background versus a surgeon that maybe has 1 or 2 a year. Believe me, it makes a difference, and I'll go over that a little bit more into the slide. So, treatment and clinical trial. So, the new regimen is FLOT. So, everybody that's listening out there that's going through the battle, I'm sure they've heard that before. So, the treatment was pre-FLOT, total removal of the stomach, and then, which I will be going through in about a month, is post-FLOT. The clinical trial that City of Hope offered to me was FLOT plus Keytruda, which for people that don't know, Keytruda is an immunotherapy. A lot of hope in immunotherapy, teaching your body to overcome and fight the cancer itself. So I decided to go with the clinical trial for a couple reasons. So my first reason, when I was talking to my wife and my family, was how great it would be to give back to the cancer community. To give an opportunity to be part of a study that, hey, if it works, great, and I was part of it, but if it doesn't work, at least we got the research out there to let them know what not to use. Obviously, the ability to be a part of something new. This trial that I'm on is in its first phase, so it's brand new. I was City of Hope's second patient on this trial. So it was a great time to be a part of something new. When you're on a clinical trial, a lot of times, from what I understand, is part of the reason why I went with it, is they delegate a nurse to you. So you have a nurse almost 24 hours, whenever you need one. When you go into the hospital, you meet the nurse that's part of the clinical trial, so she's there with you going over anything. And then also, you get more testing done. And for a lot of patients out there that aren't aware, with clinical trials, a lot of them will pay for your boarding. A lot of them will reimburse you for your gas. And I think the reason why clinical trials are so scared is because a lot of them are offered at major cancer institutions, and not everybody has access to getting there. And one of the things that I've heard through this clinical trial that I'm on is, what happens if you don't live nearby? You have to go and you have to get a hotel. You have to go and you have to fly or drive out there. And a lot of the clinical trials will pay for boarding. There's a lot of the societies out there will help you with the payments of boarding if you're part of a clinical trial. So I recommend anybody that's out there to look into the clinical trials, because not only is it up to date, medicine, it also, you have the ability to be a part of something. You have the ability to be a part of a possible cure, and the research is really, really needed. So I chose the clinical trial. And then my current state. So I was actually tested, I tested positive for the CDH1 mutation. And if people don't know out there, the CDH1 mutation is the stomach cancer gene mutation. It only affects 1% of all stomach cancer patients. Like my oncologist told me, I had a better chance of winning the lottery than I did of getting this gene. but I'm here now. You know, we lost my aunt passed away about 8 years ago from stomach cancer, diffuse stomach cancer, and we had no idea at that point that it was running in our family. We just thought that, you know, unfortunately, she got cancer, and and it took her pretty quick. So when I was diagnosed with cancer at 32, they decided to run the test on me, and we came back positive. So on October 22nd, 19 days ago, I had my stomach removed robotically. As you can see, I'm right here. I feel good. The robotic surgery lasted 12 hours, but it was, in my opinion, it was really worth it. Within 4 days, I felt back to normal. Within 5 days, I was eating solids. I was walking around the hospital, running laps. I had no pain medicine after the 3rd day. And I really believe that the reason why I'm up here and able to speak today is because I was able to have the robotic surgery. I will start chemo again in December. Chemo is on the flat regimen. It's not easy. You know, it's very tough, but I'm very hopeful, and I'm very optimistic on, you know, the outcome that's going to come after this chemo is done. So cancer is not the end of the world, and I'll be the first to tell you that. So when I was diagnosed with cancer, a lot of people will say, well, you know, give that year up. I just focus that year on fighting cancer, but that's not what I wanted to do this year. So this is me in October. I married my wife. So, you know, I just want to show everybody out there that, you know, when you get cancer, you could still live, you know, and that's the key. Oops, okay. With that said, guys, thank you so much for hearing me out. There are a couple of things I want to say real fast. We have some warriors out there that I want to say, you know, a special hi to. You know, Amber Salazar, you're in our prayers. You know, Lisa, Marissa, love all of you guys out there. I know there's so many more names, Jordan, that I'm missing, but I just want to let everybody know that's watching, you know, you're in our hearts, you're in our prayers, and we're going to beat this, okay? Thank you guys so much.
Thank you for sharing that. Well, should have let Jason do my part and just open this thing up, right? Jason, thank you. That was an awesome presentation, inspirational story, and you know, my wife has said that she's become an unwilling expert in stomach cancer. And as I watched that happen, I used my kind of business administration skill set that I've developed over the course of my career to push her to start this thing. And I've learned a lot about stomach cancer, and I guess I've become a, I don't know, unwilling associate expert by way of my wife. But I learned stuff from that presentation that I have questions for you. And I guess that gets me to my next point is, really, you know, one of the ideas of Hope for Stomach Cancer is obviously education and empowerment, because Jason's so right, you gotta fight. I mean, I can tell you stories that are not appropriate for even internet streaming, where I had to get on the phone with our insurance company or my father-in-law's insurance company and have some extraordinarily colorful and heated words. But it is a fight, and it is a community, and one of the other takeaways that I wanted to point out is talk to everybody, talk to each other. We're a family now, whether you like it or not. We're a family. So thank you again, Jason. Branny, I've another person that I've known of for years, and I think we just met for the first time here in person, but we've seen each other at different conferences and not known it from what I understand. But Branny is also a stomach cancer survivor, and she's going to share her story as well. But as I mentioned earlier, Branny's also a veteran, and we're coming up on Veterans Day. So Branny, thank you for your service, and we look forward to your story as well.
Sorry, trying to get set up here. All right, well, good morning, everyone. Thank you
Good morning.
for taking the time to be here, and thank you, Aki, for inviting me to this event. So as you guys heard, I'm a military veteran. I served in the Navy for 8 years. And, oh, what did I do here? Sorry. I served in the Navy for 8 years as a hospital corpsman. It was a very good experience. I loved it, but then I started my own family and my priorities changed, so I got out. And I was really excited about being a civilian again. Things seemed to be falling into place. A lot of people expected me to fail once I left the military. And so I was ready to prove them wrong. I was in nursing school. I had 2 young boys, and things were, like I said, falling into place. In September of 2012, I began experiencing a lot of fatigue to the point that I had to stop at the top of the stairs to catch my breath, and I could feel my heart pounding. And being that I was in school and I had 2 young kids, I put myself last. I kept saying, I'll go next week. I'll go get it checked out next week. And I thought the fatigue was from running. I used to like running a lot. And it was until it got to the point that I couldn't function that I decided, okay, I need to go to the urgent care and get this checked out. I expected to hear that I was having heart problems or something along those lines. But I was diagnosed with anemia. And being that I had a little bit of a medical background, I kept asking, why am I anemic? And the doctor just kept explaining that it was normal for women my age, women of childbearing age. And I said, well, nothing has changed in the last year. That still doesn't explain why I'm so anemic. I basically had like half the blood volume that I was supposed to have. So that's why I was having the shortness of breath and the fast heart rate. So he gave me 2 options. He said, you can either ride this out and wait to feel better, wait for your body to recover on its own, or you can have a blood transfusion. And I thought, well, I can't function, that's why I'm here. Let's do the blood transfusion. They gave me 3 units of blood, sent me home the next day. I was already feeling better. And I thought, great, it's taking effect. Okay, energy's coming back. And that evening when I went to get ready for bed, I felt a little lightheaded. I went up the stairs and I started getting tunnel vision. I managed to call out for my husband and he caught me right at the top of the stairs. Thank goodness I managed to call out for him and that he was there. So he caught me, carried me over to the bed, and then I came to again and I vomited basically all the blood that I had infused the day before. And he called the paramedics. So this time I was taken back via ambulance, and then they decided to dig a little deeper and see why I was bleeding. They said, you know, you have a GI bleed, obviously. We just have to go in here and take a look and see what's going on. So they did an endoscopy, took biopsies. They didn't find an active site of bleeding when they went in, but they found gastritis, which is inflammation of the stomach lining, and a bacteria called Helicobacter pylori, which is known to cause stomach cancer. So I was treated for it. The doctor told me, you know, it's simple. We give you antibiotics, we'll retest you, and then we just move forward. I said, okay, great, sounds pretty simple. So I went through the treatment, was retested, everything came back clear. And so I thought, all right, I'm on my way to feeling better again. Well, I continued to have stomach issues. I began having a lot of heartburn, nausea when I ate. And so I went back to this GI specialist and I said, hey, I have these stomach issues going on. I don't understand why, if the bacteria has been eradicated, I should feel better, right? And he says, well, you have gastritis and you do have some effects from the bacteria. So he said, let's go ahead and put you on an acid-reducing medication. We tried it, it didn't work. So he said, well, let's try a different one. Tried that one, also didn't work. Then we switched to what's called a proton pump inhibitor, and it also didn't work. It actually made me feel worse. So I sat down and had a conversation with him. I'd been researching H. pylori, and I saw the stomach cancer link, and I also saw data that showed that it's a very common cancer in Japan, and I was stationed there for 4 years. So I thought maybe there's some type of connection here. For me, that raised a red flag, so I thought, I should mention all these things to him. So when I asked about stomach cancer, I had a very similar reaction to Jason's. I was told I was way too young and that it was rare here in the US. And I said, okay, but I lived in Japan for 4 years, and it didn't really seem to matter. He said, no, you're too young. This is not how cancer presents itself. So I ended up finding a different GI specialist, and I explained the situation and my concerns, and he also told me I was way too young. I ended up having a conversation with him and saying, I want to manage this through diet. I would like to just try cutting out some foods. I think I know what's irritating my stomach, so can we give that a shot and not do medication? He said, sure, let's give it a try. And it worked. It worked for about 6 months. I felt really great. But then the GERD came back, the nausea came back, the fatigue came back, the same fatigue that I had before. And so I thought, okay, this guy's not listening to me either. He keeps insisting I'm way too young to have this cancer, but I know something's going on. And so I went to a different specialist, and this one ended up diagnosing me with chronic stress. She said I had too much on my plate. I had young children, I was in school, I was running a lot, so she said it's a lot for anyone. You need to meditate more. And so at that point I stopped going to the doctor, and I felt like perhaps I was stressing myself out so bad that I was making myself sick. We all know stress can do a number on our bodies, so I stopped going. And it wasn't until, so it was November of 2013, that I woke up and I felt the worst I've ever felt in my life. My entire body hurt. My head was pounding. It felt like it was about to explode. And so I turned to my husband. I said, I need you to take me to the ER. Something's wrong. And he said, are you bleeding again? I said, no, I just don't feel well. He takes me to the ER. I check in with the triage nurse. And she tells me, oh, honey, it's probably just the flu. It's that time of year. Go ahead and have a seat, and we'll call you back when a room opens up. I said, okay. I went and sat down with my husband, and I was just feeling frustrated because I felt like this is all going in the same direction again. I'm getting brushed off again. And so I just looked at him and I said, I'm going to lie about my symptoms. I'll be back. And so I went back to the nurse and I said, something just happened that I kind of played dumb. My husband said I should mention to you. And I said I just went to the bathroom and I had some bleeding. I had a lot of pain in my abdomen. And she said, oh, in that case, let's get you checked in. They miraculously had a room open now. So they checked me in, do the exam, said, yes, you're bleeding. We've got to figure out where you're bleeding from. Put a tube into my stomach, and as soon as it hit the stomach, we saw blood come up. So then they said, you are having another bleeding ulcer. You're way too young to be having these symptoms. We need to figure out what is causing it. So then I finally was able to have another endoscopy after over a year of trying to tell these doctors, hey, something's going on with me. So they finally did it, and then it was a few days before Thanksgiving, my doctor called me because he was already on vacation, and he said, I don't typically do this over the phone, but I really feel that you want to have this information. So he said, you do have stomach cancer. And he said, we'll refer you to an oncologist and, that whole thing. I said, okay. I was calm while I was on the phone with him. But as soon as I got off the phone, I fell apart. And I just, part of me knew that I already had stomach cancer. But it was still shocking to go from being an active mother, a student, and just being so active in life to all of a sudden I have this silent killer. It was extremely frustrating for me just because I sat there telling multiple doctors and they just said, "You're too young. You're too young. It's that simple. You're too young. It's not possible." So I think that was the biggest challenge for me in the beginning, was getting diagnosed, getting somebody to listen to me. And I'm glad that I pushed for more answers, that I kept going, and that I lied about my symptoms, because if I hadn't, I don't know if I'd be here. I ended up, I had a partial gastrectomy. They removed 80% of my stomach in December of 2013. That was also challenging in that I had a really difficult time eating. There were a lot of things I could not consume, sugary foods, carbs, grains. I couldn't have things that in the past I considered healthy foods, like doing kale shakes, broccoli, all upset my stomach to the point that it was just unbearable pain and vomiting, and it was just so difficult. I had no energy. And I started chemo shortly after. I did chemo. I did 5-FU and oxaliplatin. Then I had radiation therapy in combination with the chemo. And then I had more chemo after that. So throughout that time, there were a lot of side effects that I dealt with that I didn't feel like the doctors knew too much about. For example, reactive hypoglycemia. That's if I eat something sugary, my blood sugar will spike and then it drops really low and I feel like I'm going to pass out. But nobody told me about these things, so I kind of, in a way, had to rely on support groups. I got a lot of information from other patients who were going through the same thing, and they were able to guide me in the right direction. So I ended up completing treatment in July of 2014, and I did well for about 2.5 years. I did have a lot of anxiety of a recurrence, and but overall I did pretty well. I started running again. It felt like life was going back to normal. I was even talking to my husband about going back to work. And the scans were all coming back clear. In November of 2016, I had my last clear scan. And by January of 2017, I had a recurrence. I developed 2 large tumors on my ovaries. You can't hear me? Can you hear me now? Okay. I developed 2 large tumors on my ovaries, which are called Krukenberg tumors. And I was told my only option was chemo. Nobody wanted to do surgery. They said it was too risky. They didn't even want to do a biopsy. So I thought, okay, I'll start the chemotherapy and we'll continue looking for options during chemo. So I began speaking with surgeons, and they all kept giving me different reasons why they couldn't do it. Some said I would have a terrible quality of life afterwards. Others thought I wouldn't benefit from it. They presented data to me and said, look, these patients generally don't do well. Others didn't have experience with the type of tumors that I had. So it took seeing 5 doctors before I got a yes. I just kept getting doors closed on me, and while I was researching the procedure that I wanted to have done, I was speaking with 3 patients that had gone through it in the previous year. And in that time that I was waiting for my surgery date, they all passed away. So I began to question if I was making the right decision. What I wanted done was a surgery where they remove the tumors and they go in and they infuse a heated chemotherapy into the abdomen. It's pretty intense. It was supposed to last 12 hours. And, when I met with the last doctor, she was so different. She gave me hope. She explained that it was a simple procedure. She said, we can definitely do it. It's low risk, which was so different from what I experienced with other doctors I met with. So it was a breath of fresh air, but I was scared. I'll admit that. I was terrified. I didn't know what my life would be like when I came out of that OR, or if I would even come out of the OR. I was just so scared. I thought, what if she opens me up and the cancer has spread even further? And she says there's nothing she can do. You know, at that time I was given less than 6 months to live, so it was just such a difficult place to be in. When you're given a prognosis like that, I think we want reassurance, we want hope, we want answers, and I didn't have any of those things. I didn't qualify for immunotherapy, and like I said, I had trouble finding a surgeon, so it was just an extremely heartbreaking and frustrating situation to be in. But I've had a lot of great doctors step into my life, thankfully, and it took some time to find them because I've also had some terrible doctors who just wouldn't listen to me. But I'm thankful for all of them, and this doctor was able to do the procedure. She did it in half of the time that she expected, so instead of 12 hours, it was 6. My hospital stay was 4 days, not the 2 weeks that we expected. And everything went really as ideally as possible. I don't know that if I'd be here if I hadn't pushed for having the procedure done. You know, I did take a big risk, but I didn't have very many options at that point. And I mean, we faced so many obstacles aside from not being able to find a surgeon at first. We had to fight with the insurance companies. They denied the procedure. They said it was experimental. So thankfully I had a good doctor, and she called the insurance company and explained the situation to them, and it got approved. We got the call the night before the procedure. And we were relieved because it was supposed to be like a $90,000 procedure or something insane. But everything has gone well. I'm over a year out from surgery now, and I'm pretty much back to normal. I can eat normally, I'm active with the kids again, and I'm just thankful that I was able to be connected with some amazing doctors who fought for me, who decided to take a risk. So I say to all the warriors, caregivers, just keep pushing. If there's something you don't understand or there's something you don't have an answer to, just follow your instinct and really just keep pushing for answers. Advocate for yourself, like Jason said. We are our best advocates. We, you know, these doctors, they're professionals in healthcare, but I always say we're professionals in what our body feels like. If something doesn't feel right to you, then just keep pushing. So I'll end with that. Thank you very much.